Hello students, I am Dr. Deepika Paliwal on the behalf of School of Medical and Allied Sciences, Calcutta University. Welcome you in this virtual process of learning. Today we will learn about progesterone that is related to the course Medicinal Chemistry 2 with code BPSD 5001. Progesterone is a hormone that is released by the ovaries. Changing the progesterone level can contribute to abnormal menstrual period and menopausal symptoms. Progesterone is also necessary for the implantation of fertilized egg in the uterus and for maintaining the pregnancy. Prerequisite: before we start this lecture, the student must be aware about the term hormone and sex hormones. These topics you already covered in your previous semester. Objectives of today's lecture: the student will learn about functions of progesterone, the mechanism of action of progesterone, biosynthesis of progesterone, and the different class of progesterone derivative with their chemical structure. Introduction of progesterone. Progesterone is a natural progestin is produced in response to luteinizing hormone by both females and males. It is also synthesized by the adrenal cortex in both the sexes. Progesterone is secreted from corpus luteum 10 to 20 mg per day in the later half of menstrual cycle under the influence of luteinizing hormones. Its production declines a few days before the next menstrual flow. Progestin promotes the development of a secretory endometrium. Functions of progesterone: it makes the endometrium develop and secrete the fluid after being primed by estrogen. It also maintains the function of the placenta and fights off unwanted cells near the bone that could cause damage to the placenta or the fetus. It keeps the endometrium in a thickened condition so that sperm do not enter into it. It also stops the uterus making spontaneous movements. It also stimulates the growth of breast tissue. It prevents the lactation until after the birth. With the help of estrogen, it also strengthens the mucus plug covering the cervix to prevent the infection. It also increases the strength of the pelvic walls in preparation for the labor. It stops the uterus from contracting, thus keeping the baby where it is. Biosynthetic pathway for progesterone. Progesterone is synthesized from the cholesterol and the various intermediate reactions are involved in that. First, they are on oxidation. They gives pregnenolone, which on dehydration, and then keto-enol tetamerism and enol keto tetamerism take place and gives us the progesterone, a natural hormone. Progesterone are classified into basically two categories: derivative of progesterone and synthetic progesterone. In the derivative of progesterone, some are natural and some are synthetic. For example, progesterone, mid-hydroxyprogesterone acetate, 17-hydroxyprogesterone caprate, and the megestrol acetate are the semi-synthetic derivative of progesterone. Second class of progesterone are synthetic progesterone. These are the progesterone derivatives which are synthesized in the laboratory. Examples of these drugs are ethistrone, norethistron, methistone, dimethistone, desogestor, levonorgestrel, and the norgestrels. Now discuss the SAR of progesterone derivative. The presence of steroid nucleus, that is the cyclopentano perhydrophenanthrin ring. This ring is basically compulsory for the pharmacological activity of progestins. Ketone group at the carbon 3. Look at this position. The ketone group at carbon 3 position, that is not essential for the activity of progesterone because removal of it retain the progesterone. For example, look at the structure of digestrol. This moiety do not containing the ketone group. So ketone group at the position 3 is not necessary for the activity. Presence of ethyl or ethinyl or diethyl group at C17 in the alpha configuration increase the bioavailability through oral route but decrease by the subcutaneous route. If you substitute this ethyl or ethinyl at the 17 position, this will increase the oral bioavailability of the drug. L-enantiomer of the compound resulting from the substitution of ethyl group at the C-ring junction found to be active. Derivative of the progestin like 3-oxime 17-ester decreases the androgenic side effect while retaining the progestin activity. Introduction of halogens or methyl at C6 or C7 atoms at this position in the alpha configuration increase the hormonal activity of the progestin. For example, medroxyprogesterone acetate. Presence of methyl at the 19 is not essential for the activity because its removals lead to the formation of the compound with increased activity. Look at the structure of norgestrol. It do not containing the methyl moiety at 19 position, so it is not necessary for the activity. Addition of chloro or fluoro at C21 prevents the metabolic hydroxylation and which will enhance the oral effectiveness of the drug. Unsaturation in the ring A and B enhance the activity of 19-norethindrol. For example, trimethistone. Addition of methyl at the 18th position also increases the activity. In ring D at the 17th carbon, acetylation of 17-alpha hydroxy increase the duration of action. Summary of today's lecture. Progesterone is a hormone that occurs naturally in the body and it is also synthesized in the laboratory. In mammals, progesterone, like all other steroid hormone, is synthesized from the pregnenolone, which itself is derived from the cholesterol. Progesterone is also used as a medication, such as in combination with estrogen for the contraception or reduce the risk of uterine or cervical cancer or in the hormonal replacement therapy or in feminizing hormone therapy. Progesterone is also necessary for implementation of the fertilized egg in the uterus and for maintaining the pregnancy. Progesterone is a hormone that is released by the ovaries. Changing progesterone level can contribute to the abnormal menstrual periods and menopausal symptoms. Student, look at the practice question asked in your examination. Discuss the SAR of progesterone. What are the different chemical classes of progesterone? Draw the biosynthesis of progesterone and outline the different function of progesterone. Students, if you want more information regarding this topic, you can refer to this reference book. We will meet again in the next lecture. Till then, take care. Namaste.